Project Brief was really started with the thought of trying to find patients early in their disease process. We offer testing to all our patients in the emergency department. It's not a targeted model. Everyone is offered. It's really a routine model.
Hi, my name is Kara. I'm a public advisor for Project Brief.
We created 2 different videos. One which was an informed consent type video where we would go over all the essential elements to HIV testing. And then a prevention video which would go over really key elements of how to prevent the disease or the spread of the disease. Then we took it to the next step, which was embedding those videos into a tablet PC, into a computer program that would allow patients to really answer very sensitive questions. We're able to get information on how many times patients test, what their knowledge is about HIV testing and transmission. We've tested over 30,000 patients. And we're close to now about 170 patients that we've diagnosed over the past 2.5 years. And that is significant because when you think about the spread of HIV, it is those individuals that don't know that they have the disease who transmit the disease at a higher rate. What we find also with our patients who are negative is that they come back to the emergency department looking for our public health advocates, 6 months or a year if they feel that they want to be tested again.
St. Barnabas has been a designated AIDS center since the early 2000s and has been providing care to people living with HIV since the mid-80s. We decided to go to routine testing. We use mobile carts for rapid testing in the emergency room and in the inpatient units. The counselors have fully stocked carts with all their paperwork, their kits, literature, and they take those carts and they just wheel them around from room to room. The benefit of using the cart is that you actually bring the service to the patient, not the patient to the service.
We're offering all the patients of this floor rapid testing.
Very similar to doing a mobile van on the outside on the street, but yet you're doing it in the hallways. When we have 2 counselors working together, they can actually test up to 6 patients in an hour. We found 50 new positives in 2008 who may not have been identified because, again, it was the counselors going up and just asking them if they wanted to be tested rather than waiting for a referral.
Bronx Lebanon Hospital has had a formal HIV counseling testing program for many years now. It first developed in the emergency room and in the inpatient wards at the main hospital. In the past several years, we've expanded it to several outpatient settings, including the Martin Luther King Clinic, where we have a counselor on site 5 days a week offering routine HIV counseling and testing. HIV counseling and testing is offered a number of points during the patient's visit to the MLK clinic, first by the clinic greeter, and then when the patient registers at the front desk. They are first formally asked about HIV counseling testing by the PCT, or the patient care technician who does the vitals. This is the first point in the clinic stay where there's a private one-on-one interaction between a clinic member and the patient. Also, all patients go through the PCT before they see either a nurse or a physician. If they accept testing, the PCT then alerts the HIV counselor and tester, who's on staff here. If they decline testing, the nurse or physician who is then going to see the patient can re-engage the patient about it. One of the reasons we're very happy with our success here at the Martin Luther King Clinic has been our ability to engage the existing clinic staff into the process. In many places, we are limited by the number of patients we test because it is just the HIV counselor and tester who is pretty much doing the entire process. Here, because we've engaged many parts of the staff, we can increase the number of patients we offer the test to each day and increase the number of patients we test.
Okay.
Thank you.
That was easy, right?
Yeah.